Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Philippines confirms its first case of the new Omicron subvariant BA.2.12. The National Task Force says it is preparing for an imminent rise in COVID-19 cases next month. Health spokesperson Maria Rosario Vergeire joins us live. And a first in Philippine performing arts as three top dance companies come together for a historic collaboration. Ballet Philippines' Kathleen Lichtenstein and Ballet Manila's Lisa Macua Lizalde will join us later in the program. A more transmissible Omicron subvariant has been detected in the country for the first time. The health department says the BA.2.12 subvariant was found in a female foreign traveler in Baguio City. She had mild COVID-19 symptoms 9 days later and tested positive for the virus. The sublineage has fueled a surge in the U.S., but no data yet about its severity. The world is also cautious of other subvariants in South Africa and Europe. National Task Force Against COVID-19 Chief Implementer and Vaccine Czar Carlito Galvez earlier said they are preparing for an imminent rise in COVID-19 cases in May.
Based on this graph, the new South African variants are now making an uptick, and it's a matter of time that the Philippines will follow maybe 2 weeks or a month from now, as predicted by experts. Nakita natin, medyo almost perpendicular yung South African. And yan po ang nagiging parang po natin, basihan na yung timing po na pagka naunang South Africa, susunod ang Europe.
The COVAX facility will be replacing over 3.6 million expired COVID-19 vaccines in the country. Health Secretary Francisco Duque says these account for almost 1.5% of the total supply. Aside from the expired vaccine donations, Duque has asked the facility to replace those procured by the government and private sector. COVAX has yet to respond. Let's now go straight to the source of the story. We have Health spokesperson and Undersecretary Maria Rosario Vergeire. Yusek, welcome to the source. I hope you're ready. Thank you so much for your time.
Yes, good morning ma'am. Magandang umaga po sa inyo.
Okay, thank you po. First case po ng BA.2.12, which is really a subvariant of Omicron, already detected in a female traveler who went to Baguio. What we know so far, she's 52 years old from Finland who arrived last April too. Please tell us more about this case. I understand she already left the country.
Yes ma'am, no? So this is a Finnish female. She arrived in the country last April 2. She was fully vaccinated and she didn't have any symptoms at all when she arrived. That's why she was allowed to enter the country. She went straight to Quezon City when she arrived here in Manila. She conducted a seminar wherein she had 9 close contacts. Among these 9 close contacts, all of them did not have symptoms at all. And 2 of them were tested and found to be negative. She went straight to Benguet. In Benguet, she conducted another seminar wherein she had 5 close contacts. All of them are closely monitored. But then again, on the 9th day of her stay here in the Philippines, in Benguet, she experienced sore throat and headache. And therefore, on April 10, she was swabbed. And on April 11, her result was out. It was positive. She was immediately isolated. She was admitted in Baguio City, wherein she stayed for 5 days in isolation and then was tagged as recovered. She went back to her home country on April 21.
And then when she left, was that the time that the Philippine Genome Center was around that time testing on what lineage or what variant she was positive with?
Yes, actually, during the time that she turned positive, her specimen was already submitted to the Philippine Genome Center for testing or for sequencing. The results came out this week. That's why we were able to inform the public. Although close contact or contact tracing was already done, we even had our contact tracing with the different passengers in the plane when she arrived, no? Because we were looking at this 14 days incubation of the virus, and so we said that April 2 would be part, no? April 10 siya nagkaroon ng sakit, so yung 14 days ay kasama po yung April 2. So we had our contact tracing in the plane, and all of them, most of them were fully vaccinated. Nobody still have symptoms up until now.
Okay, that sounds good. But it's also good you're refreshing us on sino ho ba talaga yung mga close contacts. So you're looking at the dates April 2 to 16. That's what you said a while ago. But just help us understand again, because she's positive with the BA.2.12 subvariant of the Omicron, but she got the symptoms, or she manifested the symptoms 9 days later upon arrival, tested on the 10th day and positive on the 11th day. Are you likely to conclude that she got it here in the Philippines, she got it in the plane, or she got it from Finland?
For now, we are considering these three scenarios because as I've said, we are considering the 14 days incubation period of the SARS-CoV-2 virus. So if you look at that, she might have gotten that from her home country.
Mm-hmm.
She might have gotten that while she was traveling or while she was in the plane, or she might have gotten that here in the country, in the Philippines. So ito po yung tatlong scenarios. No, we cannot say right now where really she got it. What we are doing right now is closely monitoring and trying to do sequencing also among these individuals, no, na nandun po sa mga nakasalamuhan. Yeah.
Okay, so there's still no conclusion where she could have gotten it. There could be three scenarios, as Undersecretary Vergeire was saying. So let's go to the close contacts. I know you gave us a rundown of that a while ago. So she went to two areas where she held, I believe, some training or a seminar of some sort. One was, is it correct, a university in Quezon City? Tama ho ba yun, Yusek? Let's start with that.
Yes, ma'am, that's right.
Okay, so nagkaroon po siya ng 9 close contacts dito. And ang sabi niyo po, 2 tested positive. So does that...
Negative, ma'am.
Oh, sorry, I'm sorry.
Sorry.
2 tested, yeah, I think you're right. Mali po yung nasulat ko, tested negative. What happened to the 7?
Because these 2 tested negative, they were initially having this test. Meron po silang siyam, fully vaccinated, walang simptomas, kaya hindi pa ho natetest ng Quezon City. Meron po apparently may isa, but not verified yet, among these 9 who had parang scratchy throat and parang runny nose. But hindi bine-verify pa ho namin if this specific individual was tested. We are trying to verify with the Quezon City Epidemiology and Surveillance Unit why the other individuals who were part of the close contacts of this Finnish female were not tested.
Correct. That would be my next question, because if 2 were negative, which is good news, what happened to the other 7? So that's still something you're trying to determine. And then she went to, you said Benguet, and there were 5 close contacts here, Yusek. Could you tell us again what happened, any information or findings on the 5 close contacts?
Yes, ma'am. No? So these 5 close contacts are closely monitored, no, by our epidemiology and surveillance units. Wala po tayong bine-verify pa natin if there had been some tests done among these individuals. But let me just clarify this. Based on our revised protocols, if you are fully vaccinated, you were exposed as long as you have quarantined yourself. Kung kinakailangan po, yung testing po kasi hindi na po natin masyadong pinapatupad yan. Kaya po siguro yung ating mga local governments were not able to really test these individuals. But right now, they are in close monitoring, and we are verifying kung tinetest pa ho o itetest pa ho nila itong mga tao.
Pero siguro, I understand what you're saying with regards to the protocols, no, Yusek, but because we have this BA.2.12 right now, do you think it's mandatory from here on that testing be required? Or do we still stick to the isolation? Because the problem may be, hindi ho talagang mahirap pong bantayan, at baka yung iba po, yung iba hindi ho talaga sumunod dun sa isolation period kung naging close contact man sila.
Yes, ma'am. No? So that's part of what we do naman. We monitor closely these people, no, identified as close contacts are being closely monitored. And kapag ka ganitong intensive po yung ginagawa nating tracing of contacts, especially now that we have initially detected the BA 2.12 here, yung testing po can be done naman. Kaya lang nga, I'm just saying that during the time that the BA 2.12, no, hindi pa ho informed ang ating mga resus, pinapatupad lang nila yung protocol. Kaya nung initial, walang test na nagawa.
Okay, we just need to take a very short break. We will be right back. Watching The Source on CNN Philippines, our guest today, Health Spokesperson and Undersecretary Maria Rosario Vergeire. Just to summarize that, Yusek, no? So dun sa 9 close contacts in Quezon City and 5 in Benguet, only 2 tested negative, and you're still trying to determine yung pong findings sa mga natitirang close contact. Wala pa pong positive sa kanila.
Yes, ma'am. Wala pa po tayong positive no, na nakukuha among all of these close contacts. Lahat po walang simptomas sa ngayon. Meron na po tayong 2 na nag-negative sa test. We're trying to verify if there were other tests that had been done among these individuals.
Okay. But, you know, I wanted to raise a concern because you said that even those in the plane, nahanap na rin po. But she arrived April 2. It is April 28 now. So that would be technically, what, 16 days later? So wala na ho sigurong magpa-positive doon kung itetest man po sila as close contacts of the female passenger.
Tama po yan, ma'am. No? That's right. Actually, we start contact tracing as soon as a person turns out to be positive. So during the time that the Finnish female turned positive last April 10 or April 11, we started trying to get this manifesto already para po makita natin at ma-monitor yung mga kasakay niya po sa airplane.
Oh, but it doesn't seem like that would be very accurate anymore, no, Yusek? Kasi even if she turned positive April 11, if you ask for the manifest on April 11 or April 12, by the time you get it, what I'm trying to say is natapos na po siguro yung 14-day incubation period.
Yes, that's right, ma'am. That's why we, as I've said, we closely monitor these individuals. We're doing symptomatic monitoring if they will have symptoms, of if any of their families will have symptoms as well.
Okay. Tell us more, Yusek, about this BA.2.12. Of course, again, it's a subvariant of Omicron because we're also hearing a BA.4 and a BA.5. Ang kumalat po dito sa Pilipinas and in the world was BA.2.
Yes, ma'am. No? So this BA.2.4, BA 2.5, we have BA 2.12. We also have BA 2.12.1. These are all sublineages of the Omicron variant. This BA 2.12 and BA 2.12.1 are now spreading across the United States. 93% of their infections right now are comprised mainly of BA 2.12, sublineage of the Omicron. Experts are saying, based on science also, this is 2.5 times more transmissible than the original Omicron variant. Also, they have found, based on their experience, that this does not cause much severe infections compared to the original Omicron. So marami pa hong pinag-aaralan ukol dito sa iba't ibang sublineages ng Omicron. It is not still being classified by the WHO as a variant of interest nor a variant of concern.
Yeah, so not yet still a variant of interest or variant of concern, but let's concern ourselves with what you said, that we know what happened after Christmas and New Year na kumalat po Omicron sa atin. I know that it's kind of hard sometimes, Yusek, to go into the specifics BA.2.4, but we know it was Omicron. But this one, this particular subvariant, as you mentioned, is 2.5 times more transmissible. Ibig sabihin, mas nakakahawa pa to doon sa nakita natin noong January. Mas nakakahawa pa ito ng times 2.5. So, what kind of scenario are you seeing? But on the flip side, on the good side rather, if there is a positive thing here, it doesn't seem like it's deadlier.
Yes, ma'am. No? So, tama po kayo. That's right. It is more transmissible than the original Omicron. During the time that Omicron was detected in the country from January to March, we saw the spike in the number of cases in the country as much as 32,000 cases in NCR alone per day. So dito po sa iba't ibang variants na pumapasok, we made our projections kung saan if a variant of concern or this kind of variants comes in the country and there would be reduction in the compliance to minimum public health standards, we would be seeing around 60,000 cases per day just in NCR alone.
Yeah, and it doesn't help that we are all up and about. We are all living as if there is, well, most siguro na nakikita po natin, especially may kampanya and with the elections, of course, coming up. But I just wanted to find out first from you, Yusek, how likely do you think that this BA.2.12 subvariant is already here? Knowing that ibig ko sabihin, here, or do you think it's really starting to spread?
Well, the possibility is there. We know the limitations of our testing. We know the limitations of our sequencing. So the possibility of BA.2.12 is here. Meron din ng posibilidad na ibang variant. Baka nandito rin, ma'am. That is that's a possibility that we are preparing for. Kailangan lang po natin malaman na ito pong mga variants na ito, talagang hindi naman natin masasabing mapipigil natin ang pagpasok nila sa ating bansa. There would come a time na papasok at papasok. So what would be most important would be that we are all prepared. Prepared ang ating hospitals, prepared ang ating mga facilities, prepared ang ating local governments, and individually, kailangan meron po tayong bakuna, boosted tayo, we comply with minimum public health standards.
Right.
So possibility is here.
Right. In fact, I think Secretary Galvez was saying that there could be an imminent spike within 2 weeks or even 1 month. There have been a lot of interviews I've seen na nagsasalita ho kayo, Yusek, about the elections. I want to repeat this sana before we let you go. May 9, sakali pong meron silang nararamdaman na simptomas, I'll give you the time to please tell us what should we do during election day at meron po tayong maramdaman na siguro kakaunting sakit. May ubo, may sipon, o may konting lagnat. Please clarify what we should do. At gusto kasi po nating bumoto.
Yes, ma'am. No? So, sa amin po, sa Kagawaran ng Kalusugan from the Department of Health, we are advising and recommending to all individuals who's going to feel COVID-related symptoms during the day of elections, please do not go out to vote because you might be infecting other people and transmission might happen. If you have symptoms already previous to the election day, have yourselves managed by your physicians or the local government so that you can isolate properly and maybe baka pagdating ng May 9 ay recovered na po kayo. Pero during the specific day, we really advise people who have symptoms, do not go to your voting centers because this might cause an uptick in cases or transmission within the voting precincts. Ngayon, pagdating po dun sa voting precincts, sinasabi naman po ng COMELEC kung sakasakaling meron pumunta at hindi na po talaga napigilan, pagdating doon may isolation precinct naman sila. But we still want to give it as an advisory to all of our Filipino people. Sana po wag po tayong magpilit na pumunta sa vaccination site kung sakasakaling may nararamdaman po tayong sakit para hindi na po tayo makapanghawa ng iba.
All right. Thank you so much for your time. Health spokesperson Maria Rosario Vergeire.
Thank you very much, ma'am.
Thank you. And coming up, a first in Philippine performing arts as 3 top dance companies join forces for a groundbreaking program. This is The Source on CNN Philippines. Please stay tuned.